Hello to all of you. My name is Rebecca Sweeney, and I serve as Senior Director of Programs and Policy for the Wisconsin Cheesemakers Association. And I just want to begin today by thanking all of you for taking time out of your busy schedules to join in this WCMA webinar. Throughout the pandemic, our association has endeavored to provide members with timely and actionable information so that they can safeguard their most valued resource, their workforce, and also maintain uninterrupted essential operations. I'm going to share my screen now and we'll begin. First, here's a look at today's agenda. We're going to provide a snapshot of COVID-19 transmission and vaccination rates nationwide and in Wisconsin, and then provide the latest information that we have on the new directive from President Joe Biden that he announced last week, likely to impact large employers' vaccination and testing policies. We're going to spend the bulk of our time today with a very professional and dedicated team from the Wisconsin State Laboratory of Hygiene, and they're going to be detailing OSHA's updated COVID-19 guidance for employers, as well as, and this is key, what to expect if you are inspected by OSHA. They're also going to share information about a great program that they run, the WisCon consultations. This is a free service for all Wisconsin-based employers so that they can get personalized guidance as they develop COVID-19 policies. We're going to be sure to reserve time for question and answer at the end, and we're going to start with the questions that were pre-submitted before this webinar. I'll be presenting those anonymously. For anyone else that has a question that comes up during the course of this webinar, please use the chat function and send it directly to me so that I can pose that question on your behalf. So let's dig in with a look at where caseloads and vaccination rates stand today. This map, which was created by the Centers for Disease Control and Prevention, it's updated daily, offers a snapshot of COVID-19 cases by county. The darker and bluer the county, the higher the rate of transmission. And the US is currently seeing about 146,000 new cases per day. We should also note that there's been about 1,500 coronavirus deaths reported on a daily basis. And that's the most we've seen since last winter. So we're certainly in the midst of a surge. That's no news to anyone on the webinar today. In just the past few days, we have seen reports of new cases seem to be leveling off or declining, certainly in the South. That saw the worst of the summer surge. The upper Midwest and the Northeast have largely avoided that level of spike, but I know that's cold comfort for those of you who've experienced outbreaks, and transmission rates do seem to remain steady in much of those regions. For instance, we see significant rate of increase in coronavirus cases in Ohio, North Dakota, and Maine. The CDC notes right now that all Wisconsin counties, except for Menominee County, good for them, are currently in the high transmission category. But here too, we are seeing some hopeful signs. The 7-day average of new cases fell to about 1,400, down from a peak of 1,743 on September 5th. What we see though is the more aggressive nature of the Delta variant causing a significant spike and also the rare breakthrough infection. A recent study from CDC showed that breakthrough infections are still a very small percentage of the overall cases, about 8% of total infections right now. And we're also seeing that vaccinated people largely are safeguarded from serious outcomes. Unvaccinated people are 11 times more likely to die from COVID-19. And as we heard in our last webinar with the Department of Health Services here in Wisconsin, vaccination remains your best protection against the most serious outcomes of an infection. Here's a look at vaccination rates right now. We know that about 74% of eligible Americans, that is those who are age 12 and older, are now partially vaccinated against COVID-19. And 178.7 million Americans, or about 2/3 of the eligible population, are fully vaccinated right now. I think it's fair to say that we've seen those rates be lower in rural areas still, and you all that are operating in those communities know that. Amid the plateauing vaccination numbers and the Delta variant driven surge, President Joe Biden on Thursday announced a new national action plan. Many of you have seen the news on this. President Biden ordered the Occupational Health and Safety Administration to immediately draft a rule mandating that all American employers with more than 100 workers require their workforce to be fully vaccinated or tested for COVID-19 on a weekly basis. These employers will also be required to give workers paid time off to get vaccinated. And the measure is expected to impact about 80 million Americans, or 2/3 of the US workforce. Biden is also ordering that all federal employees, federal contractors, and that's important to note because it does include a number of WCMA members, and workers at health facilities that receive federal dollars must be fully vaccinated. And White House officials indicate that that will be happening soon. It just hit today that federal contractors must be vaccinated. That means fully vaccinated by November 22nd. And full details on what they will be required to do will be coming on the 24th of this month. So we'll keep you updated on that. Those mandates are expected to impact an additional 20 million American workers. And so we'll keep you posted on that as well. For both workforce-based mandates, federal officials say that they will have those standard limited exceptions for disability or for religious reasons. Finally, on Thursday, Biden announced that the federal government will work to increase the supply of COVID-19 vaccine or COVID-19 testing supplies, which I know have been tough for some of you to come by. And the federal government also secured concessions from major retailers, so Walmart, Amazon, Kroger, to sell those testing kits at cost. Here's a closer look at what we know about that larger employer mandate. In a press briefing Thursday night, OSHA officials announced that it will be coming up with a new emergency temporary standard, or an ETS, and that will be released in the coming weeks. That's what they've said. They have not set an actual date for that yet. OSHA officials also shared that the rule will carry a penalty of $14,000 per violation. And while COVID-19 vaccines are free, you know that, neither the White House nor OSHA has stated whether employers will be required to bear the cost of a testing protocol or that paid time off. It's worth noting that for healthcare employers that are already under some mandates regarding vaccination, that they have been required to bear the cost. So a number of legal experts have pointed to that as a potential precedent for how they might move forward on this rule. The announcement did not tell us how we'll be tracking vaccination or what will be considered proof. OSHA, is this legal? Well, the jury's out, I guess, in the court of public opinion. It does seem clear that OSHA has legal authority to issue an ETS, but the ETS must show that workers are exposed to a grave danger, and such rules also have to be deemed feasible for employers to enforce. The regulation is likely to be challenged. We've certainly seen Republican governors say that they will take this plan to court. Of course, we have a lot of questions. We have more questions than maybe we have answers at this moment. We've heard questions from within our own membership. Who's responsible for vaccination tracking? Are boosters going to be required? Will boosters even happen? Will the requirements only be for FDA approved vaccines? As you know, only Pfizer has full FDA approval at this point. What is this going to do to employers' liability? If somebody gets sick in a plant, how is this going to change their legal liability? So we have a lot of questions right now. WCMA is going to continue to keep members informed of relevant developments and resources via our weekly electronic newsletter, those as needed alerts, and also through webinars like this one. And while we work to bring you updates on that new mandate and what that's going to mean for your business operations, there is already updated employer guidance and a new national emphasis program from OSHA, triggering inspections in operations like yours coast to coast. And to share some more information about OSHA's guidance and expectations, it's my pleasure to introduce our partners at the Wisconsin State Laboratory of Hygiene, Industrial Hygiene Consultant Engineer George Gruetzmacher and Environmental Health Specialist Kelli Rush. Thank you both, Kelly, George, for your work day in and day out. I know you have fielded a lot of questions from WCMA members apart from this webinar. I know you've been in plants. I know that you're working around the clock, and we really value and appreciate your expertise and time with us today. Without any further ado, please take it away.
Sure. I'm going to just check that you can actually hear me.
You're a little quiet, George, but overall can hear you.
Okay. I will change that, and hopefully that's a little better. We're going to talk today just kind of on protecting workers and the national emphasis program that's out there. Again, my name is George Gruetzmacher.
And my name is Kelli Rush.
And we're with the Wisconsin State Laboratory of Hygiene. We're in a program that offers free service to help Wisconsin business community with workplace health and safety issues. There's a service, the on-site consultation program, which covers a wide range of employers and a wide range of hazards. There's the COVID-specific service, which narrows down and focuses exclusively on issues associated with the pandemic. Right now, we're going to just kind of talk about the national emphasis program. And there's typically confusion about what different kinds of programs are, what the purpose is, and so forth. This directive came out last spring, and it's a method for OSHA to target. If we take a quick look, when the new administration came in, they gave a variety of orders back in January. They directed to have revised guidance on COVID, that was issued in January. Modified enforcement, that was issued in March. Targeting high-risk workplaces, that's what this national emphasis program that came out in March as well as coordinating outreach. So all of these are different kinds of elements. I'm going to say, again, in January is when that was done from a White House level. You can see that, all the way through March, and then the emergency temporary standard coming out later. These things are not happening instantly from when there's an announcement by policy until things are implemented. There's always a time in between, and unfortunately that always causes confusion because until you know the details, it's hard to talk about things. The national emphasis program is really here for addressing and directing OSHA. This is a document whose audience is the OSHA area directors. So this is a management document within OSHA. And the purpose is to give them direction on how to start being proactive about a hazard. In this case, COVID, there's a variety of emphasis programs on a variety of hazards. And the primary function of OSHA, if you will, is to respond to complaints and referrals. So there are a variety of sources to identify that there are hazardous workplaces, and however that occurs, they are directed to conduct inspections at those workplaces. And they're legally required to conduct inspections for most of those circumstances, so that really does keep them busy. To be proactive, to be looking at employers who are not being identified by other means, that's what an emphasis program is. And that's really what this does. When we take a quick look, it targets establishments in 3 different groupings. That is, there's 3 risk categories. One of them, do you work with infected people? This is what we're talking about with close contact to known and suspect patients. This is healthcare. Do you work with the general public? That is, you come into close contact with the general public. This is essentially the retail community. Or are you working in close contact with co-workers? And they've identified industries where that seems to be occurring, and those are the industries which have had outbreaks occur in facilities. And so to the extent that workplaces can be designed and operated so that employees don't have close contact with each other, that moves you out of that away from what that category is focused on. The more that you have them working close together, the more that it really trips that category. couple of other administrative things that go on here. If they're at a facility that doesn't show up on that targeting list, but happens to have high COVID rates, then they're going to look at those facilities. If a company happens to have very high complaint rates, they're going to keep that facility in their sites. If there's a facility that has been inspected and there's a bunch of nuances, but they'll be taken out of it. If they've been there, they don't have any reason to go back. And so that's really the purpose of that, is so they're not going back to the same place, that they're going and trying to identify new locations. Whenever OSHA does anything, they need to look at protecting the rights of workers. That is one of their legal responsibilities. And in fact, OSHA is responsible for whistleblower provisions in essentially all federal standards. So whether it's worker health and safety, but if you complain that your employer is not following the Securities and Exchange Commission requirements, OSHA is who does that inspection and looks for those employee rights. And so they're going to, when they do these inspections, they've emphasized that they need to be looking to see that employees aren't being retaliated by employers. And so whether requesting an inspection, whether making a complaint, whether reporting injuries, any of those circumstances, they're going to be verifying that employers are not retaliating against employees. The other aspect is exempt from programmed inspections in general, not just this one, but all of them, are companies that work in OSHA cooperative programs. This includes active visits with the on-site consultation program like ours, participation in programs like VPP and SHARP. Now, the key here is that all of these have OSHA or somebody working with OSHA at the location already. So that's the reason they're out of this pool. It's not that employees get away with anything. It's that OSHA is already there looking at it. They're trying to find places where they are not normally visiting. That's the purpose of that emphasis program. I'm really not going to talk a lot about inspection details. We could take an hour on this alone and not really dive into it. If people have questions, they can certainly ask. And I'm going to say after this is finished, by all means, we can have longer conversations. But OSHA is going to show up. They're going to show up unannounced. If you're in this process, what happened is that you were in one of those pools. Each area office is going to get a list of companies, 4, 5, 10, I don't know. They then have to inspect those companies. And then once they get those done, then they'll get another set of companies. So that's the reason that they'll tell you that they're there. They will show their credentials. They will, although they really do try not to, or to minimize the disruption to a workplace, but there's no way not to make a disruption. The key is that if you will, the more that you can help them focus and get their inspection for what they need done, they'll be in and out, honestly, as quick as they can, providing what they find. They'll conduct their inspection in the course of the day, and at the end of the day, they will give a summary report of what they've seen. Now, that summary report is not the final say by any means. They have up to 6 months to issue a citation. And I'm going to say that for COVID issues, the more that they need to verify that they've got a sound foundation to make a citation, the longer it takes. So to the extent that these need more review before they come out, all of those are parts of that process. Really, the key here is that companies that are complying with the protective measures we've been talking about, that are complying with the recommendations that are coming down, have really relatively low likelihood of having a negative outcome from that OSHA inspection. And we need to make sure that applicable infection prevention measures are routinely in place. Now, we can talk about the standards that OSHA uses. There is now that emergency temporary standard that applies to healthcare. Outside of healthcare, these are the standards that OSHA has been using over the last 6 months or so to identify what's going on. I'm briefly going to hit each one, and then we'll go on. Record keeping. If you have a work-related injury or illness, and if it meets certain criteria, you have to put it on your OSHA log. That is, do you have a confirmed case of COVID? That's step one. Is it work-related? Now, for OSHA, work-related for an illness means that they have exposure in the workplace. It doesn't mean that's the only place they have exposure. If there is workplace exposure, then it becomes work-related for their purposes. That's different than workers' comp. That's different than the way other people think of things, but that's the way it works. And then, do you meet a criteria? Did somebody die? Did they lose work? Did they get medical treatment beyond first aid? Any of those mean that it becomes recordable on the OSHA log, and at in March, that then gets reported to OSHA. Personal protective equipment. What are you doing to provide personal protective equipment, to identify personal protective equipment? This is required for every job in any industry, which is what makes it an easy thing for OSHA to use. This applies, by the way, not just to the COVID stuff in your facility. This applies to everything else as well. So what hazards are people exposed to? Have you done an assessment? And have you identified what personal protective equipment? Have you provided it? Have you provided training? The wrinkle here is, what have you done to in case you can't get that personal protective equipment? And so if the supply chain can't get it to you, now you have to make changes in your workplace to accommodate that. Respiratory protection program. There's a series of elements required. If you have respirators in your workplace, you have to have a program in place. We can talk about the nuances and details of it, but that is a legal requirement everywhere. And so it's, again, an easy thing for OSHA to identify. OSHA has a sanitation standard. This is one they don't use very often, and it is really not complicated. It says that workplaces have to be clean, and it says that you got to have soap and water available to wash your hands. I'm going to say that, though, like I say, those are not really pulled at a whole lot. In fact, lots of inspectors don't even know quite where in the book they are, just because it's not normally needed. However, this is a circumstance that's a place they can go into the standards and issue a citation.
This industry is really good on the sanitation front, so that's working in our favor, really.
Absolutely. And the thing is, I've done enough work in cheese plants over the years to go, yeah, if that's a question where you're at, something else is going on here. OSHA has standards that relate to exposure in medical records. If you're in a workplace and there's a record that you've got documentation about exposures, things that are in the workplace that might hurt employees, that's an exposure record. You have to keep those records for 30 years, and employees have the right to be able to get access to them. If you've got medical records, and I'm referring to work-related medical records with employee information, those have to be kept for the length of employment plus 30 years. And again, employees have a right to access that information. And then finally, the catch-all, OSHA has a general duty clause. This is, in fact, if employers would simply follow this general duty clause, OSHA would have no need to write specific standards. If there's a hazard, if it's recognized and can cause or is likely to cause harm, then those are the first three elements. And I think it's pretty hard to argue that COVID is not out there recognized and causing harm. So now, is there a feasible and useful method to correct it? That is, can you reduce the risk? And so if there's a feasible and useful method, then it meets that general duty clause requirement. Now, the challenge is that it takes a lot of work for OSHA, legal work, a lot of time to issue these general duty clause citations. So they really don't happen nearly as much as the citations related to specific standard pieces. And with that, we'll have Kelli give you information on how to try and provide protection.
Perfect. Thanks, George. So one of the key pieces here under the general duty clause are what we've seen or have heard is that businesses are often cited when they're failing to protect workers to an identified hazard by making sure that they're creating a multitude of strategies in their workplace to make sure that they can implement controls and do different pieces. So that's kind of what we're going to focus on here, some of those best practices. So the OSHA guidance. So the guidance we're going to be focusing on is available for employers to look at. Rebecca, I'm sure it's something you have shared out with your group, which is that OSHA Safe Work Guidance, or the guidance on mitigating and preventing the spread of COVID-19 in the workplace. Just as an the guidance did receive a modification that came after the July 27th update in regards to vaccinated workers needing to do some extra elements again. They also added some specific guidance for high hazard industries. So that has been updated as of August 10th. So the executive summary and purpose of this guidance was that employers should implement a COVID-19 prevention program in the workplace. And OSHA will work to continue, as we've seen so far, to update this guidance over time to reflect developments in science, best practices, and different standards that may come out, like this new ETS we've been talking about. OSHA's general duty clause is usually one, again, that is most cited for those common hazards. So these 11 steps that we're going to be working through talk about different ways to create a safe and healthful workplace, and will help ensure that if you're following some of these steps, the likelihood of you getting a slap on the wrist is much lower. So the first is a workplace COVID prevention program is the most effective way to mitigate the spread or outbreak in the workplace. To do that, step one is we need to identify a program plan administrator. So who is the individual who is responsible for administering and maintaining your COVID-19 in the plan in the workplace? This includes making sure that this individual is continually looking at guidance and updating that document so that it is a working document as standards and scientific knowledge change. We also want to work to list how managers and supervisors will work to support, implement, and comply with these plans. Additionally, it's your responsibility to spell out job duties associated with roles in your COVID-19 plan, such who is responsible for disinfection, sanitation, who's responsible for ordering PPE or finding solutions if it's unavailable for what you traditionally have. Step two, and we may have heard of this before, is our favorite hazard assessment. Again, this is the requirement, not just during COVID, but for any employer, is to conduct a hazard assessment to identify where and how workers might be exposed to hazards in the workplace. When we think about COVID, this one is specific in identifying how workers may come into contact, how closely are they working together, situations where they may be at increased risks, such as production lines where you're not able to maintain 6 feet. And additionally, we know that the most effective hazard assessments involve workers because they are most familiar with their job conditions and duties. 3 is going to be our hierarchy of controls. So identifying measures to limit the spread of COVID-19 in the workplace. I know we talk about these often, but they're not going anywhere. So the things we're going to consider are eliminating the hazard. This would be making sure we're having physical distancing in the workplace. We have remote work for maybe office or administrative staff if they're able to do those pieces, as well as telework. We want to think about separating and sending home infected or potentially infected individuals from the workplace. When we think engineering controls, this is things like ventilation and barriers. Again, our team has a wealth of knowledge when it comes to ventilation. So if there's other topics you're interested in reaching out to us on, you're more than welcome to do that. Additionally, we want to think about administrative policies that we know are successful in mitigating the spread. This includes using face coverings, staggering work shifts and traffic flow patterns, staggering break or lunch times, making sure that you have an increased rate of hygiene supplies throughout a facility, and routine cleaning and disinfection, and making sure that your infection control agents or your disinfectants are on the EPA N list for disinfectants that could be used against COVID-19 in the workplace. And lastly, we want to consider personal protective equipment or PPE. So this would be things like respirators or gloves. So since we're working with the cheesemakers, we thought it was only fitting that we use this model. This is the Swiss cheese respiratory virus pandemic defense. And it's just an example that each intervention or layer that we have can have imperfections or holes. And so you need multiple layers of different strategies in order to improve the success. So it's not just having a program administrator in a COVID plan. It's making sure we're training on that plan. It's making sure we're thinking about things like engineering, administrative, and PP controls. It's masking in the workplace. It's encouraging vaccination. Not one strategy is going to be completely successful. That's why we need to build layers. Step 4 is communicating with our workers. Any communication in the workplace in regards to COVID-19 needs to be in accessible formats and language. We want to communicate policies clearly, frequently, and in plain language. Additionally, we want to include non-English languages for signage, as well as we want to think about sign language or other accessible communication methods. And we want to make sure that anything that we're offering is accessible to individuals with disabilities as well. Step 5 is we want to make sure we're training workers. This includes training on basic facts about COVID-19, such as how it's spread, physical distancing, the use of face coverings and hand hygiene. We want to make sure that we're also training on those workplace policies or procedures, such as those COVID plans. And most importantly, we want to make sure that we're tracking the training and we have documentation to say we are actually working hard to make sure our workers have a knowledge and understanding. And again, we want to make sure that workers understand their rights to have a safe and healthful workplace and who to contact on their team if they have questions or concerns. Step 6 is going to be a really important one, and this is on suspected or confirmed COVID-19. So again, we want to make sure that our policies are clearly communicated. This includes instructing workers who are infected or potentially infected to stay home and isolate or quarantine. We want to ensure that absence policies are non-punitive. We want to make sure that policies do not encourage workers to come to work if they are sick or symptomatic. And we want to instruct workers to follow their local and tribal health department guidance or the guidance of a medical practitioner. Next, we want to make sure we're following the updated guidance for vaccinated employees. And I hear this one a lot. Well, why do we have to do this? What does this look like? Why did it change? And the truth is, new science and knowledge came out, and so we had to pivot. This means that vaccinated individuals do need to wear a mask in public indoor settings in areas of substantial or high transmission, which for us is the whole state of Wisconsin. So again, encouraging employees to wear masks indoors regardless of vaccination status, I know can be hard just because it was such an encouraging thing to get people vaccinated. But right now we're back to our focus of protecting employees. This also means that we're recommending that those individuals who are vaccinated get tested 3 to 5 days following a known exposure to someone with suspected or confirmed COVID-19. And additionally, having that individual wear a mask in public indoor settings, such as your workplace, for 14 days after that exposure or until they have that negative test result. And the next step is going to be step 8, which is screening and testing. So this is making sure that we're providing guidance on screening and testing in the workplace. So you're informing your workers of testing requirements, if any, and the availability of testing options. If they, for example, you want to implement it in the workplace and they need to arrive 15 minutes earlier, making sure that they're getting paid for some of those pieces and some of the steps there. You also want to consider implementing worker self-screenings. How are you feeling before you go to work? Do you have a temperature, headache? Are you lost a taste or smell? Are you running a temperature? This is a step that they can do at home before they even come to the workplace. And step 9 is vaccination. So we want to encourage vaccination. So this is providing information and training on benefits and the safety of vaccines that are out there. Consider hosting a vaccination clinic for employees. This can be put on with the help of the state. So if you have questions, feel free to reach out. We can connect you to a representative at DHS. And lastly, you want to remind employees that the vaccine helps prevent severe illness, hospitalization, and death.
The last two steps we've identified before. But again, if you do have a case, you need to make sure that you're recording those and reporting them properly, and making sure that you don't have anything where someone retaliates against an employee. And this is kind of one of those sort of helping to monitor management and supervision to see that nobody is acting in that way.
These are sorry,
Yep.
go ahead, George.
No, either way, it's one of those. Our time is narrowing down, so I'm trying to make sure we move along quickly. We've got reference materials you can contact and get. If you want to contact our program, you can go to slh.wisc.edu/WisCon and make a request. Call 1-800-947-0553.
Or to request a COVID consultation visit, you can reach out to us at slh.wisc.edu under occupational WisCon workplace-COVID-19-consulting. You can give us a call at 226-5246 or send us an email at covidconsulting@slh.wisc.edu to address questions or concerns about COVID-19 in the workplace.
And we're going to send all of those out to you after this in an email. So don't worry if you're writing down furiously, we'll get it to you in an email this afternoon.
Yep. And we'll get lots of information to you. We've got a newsletter and a webinar as well. Monthly, you can subscribe and get a newsletter link in your email. And every Monday at 1 o'clock, we have a webinar. The first Monday of the month, we do COVID specific, but we hit all kinds of workplace health and safety topics. And with that, you can get our contact information and we will start taking questions. And I think, Rebecca, you were going to ask them. Is that how we're going to work it?
That's right. We had a number of questions submitted in advance of this webinar. And we like to offer our members a little measure of anonymity. So I'll ask the questions on their behalf. But these questions are from our members. First one, what is the likelihood that we will be inspected by OSHA related to our COVID-19 practices? Do you have a crystal ball, George?
Yeah, the challenge is that your practices aren't going to make a difference about whether you get an inspection. They're going to make a difference in the outcome of an inspection, but whether you get a visit is going to depend on two things. One is, if you will, the random chance of being targeted. And that's intentionally to be a random chance so that people can't hide. And it's going to depend upon how well you implement measures. If you have cases, then referrals will be made to OSHA and OSHA is going to show up. If employees are unhappy with how you're managing the program, then that's going to provide more likelihood that they'll make a complaint to OSHA instead of working with you to fix it. So both of those will do it. Your actions will minimize the impact, but not necessarily, and they'll minimize the chance of an employee complaint, but they're not going to minimize the chance of the random. The random's going to be random.
So implementing a plan, taking these steps to mitigate risk in the workplace, not only help to protect your employees and to protect your uninterrupted operations, but they also guard against any sort of more serious implication of an OSHA inspection. So good to know. How can we get a bulk supply of COVID-19 tests? I feel like I want to know too. But we do have a lot of members who are considering regular testing protocols, implementing that in their workplace, and not sure where to go right now to get those Binax tests in bulk.
Yeah, so right now, at least to my knowledge, the state isn't necessarily offering bulk supply to businesses. However, I know some businesses are utilizing the strategy of the state allowing individuals to request at-home tests that are just shipped directly to their house. They can take it at home if you do have a worker who's not feeling well. That's one way to help, I guess, with a little bit of equity there. They don't have to travel or find transportation to get tested. It would get sent to their home. Additionally, we've seen a number of businesses using the 15-minute antigen testing. This is not an endorsement. I would say I actually was reaching out to a cheesemaker facility who had questions. Abbott Laboratory seems to be the one that is brought up most. They have a 15-minute test. I also believe from what I've heard from the clients that I've reached out to, it's about $5 a test. And so that seems to be a really good one. It sounds like they have good literature, a video online of how to do that for the workplace. So you can reach out to direct suppliers to do those purchase orders. Additionally, the FDA does have a website that has all of the emergency use authorization testing, quick antigen tests that have been approved. So you can go to that site, do some research, figure out maybe what's most affordable or easiest to use in your facility, but that would be a way to get bulk supply.
I'll add to this too. We did ask the question of Dr. Myman, Dr. Jonathan Myman from the Wisconsin Department of Health Services in our last webinar. One of his points of feedback to those members who are considering testing protocols is that all COVID tests approved by the FDA, including those over-the-counter antigen tests that you could get at your Walgreens or your Walmart if you're able to find them. I found CVS has a nice website for figuring out what locations actually have them in stock, are acceptable in the eyes of the state. And if you're not in the state of Wisconsin, it is worth checking in with your state agency, your Department of Health, because there are states that are providing businesses with bulk testing supplies. Moving on, we understand if our employees are vaccinated and they're exposed to the virus, they do not have to quarantine. Is it recommended or required that they get tested? Should they stay home until they get the test results, or can they work while they are waiting for the test results?
So that's a great question. The biggest piece for that is it is not a requirement, it is a recommendation. However, as an employer, you do have the ability to require that of your employee if they are a close contact of someone with suspected or confirmed COVID. The caveat to that is if they are a close contact and they do not want to go get tested, no, they don't have to quarantine. But they would need to wear a mask for 14 days during that period of time. Often the best strategy is to have them stay home quarantine for 3 to 5 days after that exposure and then go get a COVID test. That way they can return to work. The employer knows for certain that they're negative. And at that point, they could discontinue the use of the mask. But if they're not quarantining and they are not going and getting tested, they would need to wear a mask for 14 days in the workplace.
Okay, we're going to go rapid fire here with some of these questions because I know you know the answers. Where should COVID-19 testing occur if it's part of a workplace protocol? Seems like safety and privacy are concerns here.
So the biggest piece is I would often recommend you have it near an entrance of where employees are going to be checking in. Try to stagger start times if you are going to have that, and make sure your employees are maintaining at least 6 feet of distance during that period in case someone did come up with a positive result. You would also want to make sure that there was hand sanitizer, hand washing available. You would also want to make sure that they're masking during that period of time. And the bigger caveat is you need someone to do QC if you're doing that testing strategy, in which case you would need multiple individuals potentially watching over the workers who are doing their own antigen test, and be able to kind of share that privately with them if they did test positive so that they could leave. The important note to this piece, and I'll share more information with you, Rebecca, offline, is there is a reporting requirement if you are doing testing in the workplace, which means you have to work with your local tribal health department to report negative and positive tests of your workers, or you could work through the Wisconsin, it's called WEDS, the reporting system. That's often not as easy as just working with your local tribal health department to report.
Should we keep records of employee wellness surveys or vaccinations on site? If so, do you recommend electronic copies or paper copies? For 30 years.
Yeah, I'm going to tell you the answer from an OSHA side is it makes no difference. And so you're talking, my personal preference, and you're talking about my personal, is electronic is the way to actually keep those records and be able to find them and all of that. But whatever works for you is acceptable.
How can I tell the difference between a real vaccination card and a fake vaccination card?
And this is another one. The initial answer I'm going to give is take a look at it. If somebody's forging it, that's forging a government document, and that's a felony. And so, if you will, that's sort of if you've done due diligence to look and see that it looks and appears to be legitimate, just keep some way of identifying that. So when someone comes up and says, well, this one came through, it's an issue, but it's the same as someone forging a driver's license. If they do a good job of forging it, that's not your responsibility to identify it. Someone forges a bad $100 bill. You're going to try, but if they've done such a good job that you can't detect it, that's not your problem.
The other piece of that is if you feel like you are hearing maybe rumors of employees doing this, you could move to a system to use like the Wisconsin vaccination registry system, and actually have them pull up their vaccination record so that you could have a printout copy. And that is absolutely where it would be documented. It wouldn't be missed in that registry. A lot of facilities that would take a decent amount of time. You would have to have employee compliance. But if you absolutely wanted to guarantee and you were having some bad actors, that would be another way to go.
Thank you for that. If an employee was sent home from work with COVID-19 symptoms, can I request to see their testing results before allowing them back on site?
You can request them as an employer. You're allowed to do that, whether they're positive or negative. You are entitled to that information. The thing I'm recommending most is please put it in your COVID policy in the workplace and make sure your employees are trained on that expectation. That way they know what's expected of them. There's no saying, well, I didn't know about that, or you can't tell me that now. Have it explicitly stated and written in your COVID plan so that there's no kind of back and forth there. The only piece of that would be negative COVID testing is not required after a 10 to 14 day isolation period if you had previously tested positive. So you don't need to require a negative test for them to come back to work after a positive test. They just need to follow their local or tribal health department's quarantine or isolation guidance for that.
All right, one more pre-submitted question. We've got 2 quickies in the chat. CDC guidance has changed frequently. What is considered a close contact now?
So our close contact guidance actually hasn't really changed. It is still considered 6 feet of distance within a 15-minute period in a 24-hour time slot. So if you are with someone for 15 minutes or longer, within 6 feet of them, a lot of times we see that on production lines, shipping, some of those kind of bottleneck places, that is a close contact.
Okay, and then 2 questions from the chat. One, how is the employer supposed to know that someone's been vaccinated? Are they allowed to ask for proof? So we've kind of covered that with the earlier question, right? You are allowed to ask for that proof. And how are you supposed to know? You could go to the, in the state of Wisconsin, the website for vaccination registry, or you can see their card and do your due diligence. Is that accurate, George and Kelly?
Yeah, I would say for the vaccine registry, you just need to make sure you have their consent to go and look up that. So you could have a quick form typed out, have legal look at it. If they don't have their card, that would be a way to prove it as well.
All right, another question from the chat. If testing on site, sounds like there either is or needs to have a rapid outcome test that results are known immediately. So if you're testing on site, how long does it take to get your results? And what kind of training do you have to have in order to do that testing?
So typically it's 15 to 30 minutes for a result to appear. After 30 minutes, it's no longer accurate, but on average, it's about 15 to 20 minutes. For facilities that I've reached out to this week, since I was working with a facility last week who had questions, they said what they're doing is having their workers come to work potentially 15 to 30 minutes early to do this testing, staggering start times, and then they are compensated for coming to work early to do this testing, which was really important for the buy-in piece of it. So it doesn't take super long to do it. As far as training, I know just because I talked to 3 facilities, they all used Abbott. I went to their website to kind of see what it looked like. They do have training videos. Again, I would make sure that you have a supervisor or managerial employee overseeing the quality control of the testing that's going on. But you don't necessarily need to have like a medical provider or someone like a nursing staff member at a facility kind of overseeing this. It could just be kind of a supervisor or manager who has watched the training video and gone through maybe some site-specific training.
And the follow-up here on this was, our administrators of the test potentially exposing themselves? I suppose, yes, whenever you're around other people right now, you're potentially exposing yourself. But can you go through those protection measures too?
Yeah, so from the facilities I've talked to this week that are doing this, traditionally the worker themselves would be doing their own nasal swab. So it wouldn't be the responsibility of that worker overseeing it, doing those pieces. That worker would wear gloves in between doing the testing piece. A lot of times it's like this little card, you put some drops in, you have the employee do the thing, then you instruct them to stick that swab in and you have them turn it clockwise 3 times. And then you just close it up and then you wait for that 15 minutes. The real exposure to that worker would just, for PPE, would be, you would want them to have gloves for when they have to dispose of that test. Potentially, obviously a face mask, you could have face shield as well, since it is respiratory, just to protect some other pieces there. You could have them in like a procedural gown or something to protect their clothes, but that's not really necessary. It might be more of a comfort thing, but I would say as long as you have gloves, a mask, and you're potentially wearing like a face shield, if you're the one watching over it, you would have no issues.
And I'm going to add to that, in general, you're going to want to simply not be standing right next to that person for, the 20 minutes. You'll help them, but you're going to limit your amount of time to try and not be a close contact.
Yeah. It sounds like testing is a doable strategy, but the more we can push vaccination as an alternative, probably the simpler it is for the administrators on site. Additional resources, we want to just again give you a little plug to the CDC Essential Employer Toolkit. This is updated frequently. It has all of the documents that you would want to post in your facility. It also has additional guidance on how to set up your plan. This is an excellent resource. And definitely, if you're in HR, you want to have this on your desk at all times. For those in Wisconsin, the Wisconsin Department of Health Services COVID-19 resources site helps, especially if you're trying to set up a vaccination clinic. I think that's a really excellent resource in that case. And we have come to the end of our time. In fact, actually, our friends from the State Laboratory of Hygiene have been exceptionally kind and going a couple extra minutes for us. I want to thank all of you who joined us today, and I want to thank you for the really important work that you're doing. I know that it's not easy. It's not easy to do in a workforce shortage as well. Everything about your jobs right now is challenging, but the good news is we have excellent resources. Our State Laboratory of Hygiene, these folks doing the WisCon consultations have been incredible resources on site for our members, and I highly encourage you to take advantage of that service if you need some more guidance. And we also have great partners at the state and frankly in other states as well. So if you need something, say something, because we're here to help you, and we're here to help connect you with other resources. With that, thank you so much. Watch for a follow-up email from me, and have a great day.